true success is not in the learning, but in its application to the benefit of mankind. For Thailand, much alertness and importance have been given to the preparedness for, prevention of, and response to emerging infectious diseases, EIDs. Between 2005 and 2016, 3 national strategic plans were drawn up and implemented. Currently, the 4th plan, that is, National Strategic Plan for Emerging Infectious Diseases, 2017 to 2021, is being implemented, emphasizing systematic, efficient, and timely actions through multi-sectoral coordination regarding knowledge management and integration of efforts based on previous experiences and lessons learned. Simplicity and complexity of controlling multi-drug resistant organisms in a university hospital. This is Rama Hospital under the Faculty of Medicine, Mahidol University, located near the center of Bangkok. What we are seeing now is one of the bulletin boards for healthcare personnel and service recipients to see and realize the importance of hand hygiene or hand washing everywhere in the hospital. At this intensive care unit, or ICU, many years ago, a spread of multi-drug resistant organisms, MDRO, occurred. The outbreak was so severe that the ICU had to be temporarily closed, and all concerned on the multidisciplinary team had to work together to identify its causes and measures to more seriously resolve the problem.
เนี่ยคณะเราก็มีคณะกรรมการ
Professor Dr. Piyamit Sithara, Dean, Faculty of Medicine, Rama Hospital said, "We have got the Infection Prevention and Control, IPC Committee, to take charge of controlling nosocomial or healthcare-associated infections in the hospital. As we attach importance to this matter, more resources and efforts have been allocated, including budget, personnel, knowledge management, and coordination, so that the work has been more efficiently carried out, and in the end, the problem can be resolved."
ไม่ใช่เป็นการเพาะเชื้อธรรมดาก็คือเป็นการวิเคราะห์ DNA.
At present, it has been found that the simple but very efficient way of controlling the spread of multi-resistant organisms is attaching importance to hand hygiene or hand washing with alcohol-based hand rubs, and wearing a plastic gown as personal protective equipment, PPE, while rendering patient care by the doctors, nurses, and other healthcare staff is also the key to reducing the germ transmission from one patient to another.
เรื่องเชื้อราที่รามานี่เรามีการจัดการมานานแล้วนะครับ
Assistant Professor Dr. Kamthon Malatham, Chairperson, Infection Prevention and Control Committee, said, "We have assigned a code for each patient with a multi-drug resistant infection so that the doctors, nurses, and other relevant staff know and follow the clearly established practice guidelines." Other related actions include the isolation of patients with multi-drug resistant infections, awareness raising for relevant personnel about the importance of this matter, and transferring the knowledge to all concerned. Some people might regard such actions as normal practices, but actually they are effective, as per the monitoring and evaluation records in various units.
โรงพยาบาลของเขาถ้าเมื่อไหร่มีการปฏิบัตินะครับมันต้องเกิดผลแน่นอนคือคนไข้จะติดเชื้อน้อยลงและเชื้อราจะน้อยลง
The 7 steps of hand hygiene in 5 moments, according to the WHO guidelines on hand hygiene, has been adopted and practiced seriously. Today is another day on which activities of the Hand Cleaning Moving Together campaign are organized by the Infection Prevention and Control Services, IPC, a unit under the hospital's Infection Prevention and Control Committee. The activities include a hand-washing test and a questionnaire answering session. They are parts of knowledge-enhancing activities for members of the multidisciplinary team to be aware of hand-washing while working, and also for service recipients to learn of the importance of infection control.
ต้องบอกว่าอัตราการล้างมือเนี่ยเราไม่คาดหวังว่าบุคลากรต้องล้าง 100% นะคะ
Ms. Sumawadi Sakuntaniyom, IPC nurse, said, "As we have limited resources, hand washing is the simplest way to most effectively prevent the spread of germs, including multi-drug resistant and other pathogens, so that they will not be transmitted to us, patients, and the environment." Regarding the hospital staff's awareness of the importance of hand washing, now it is acceptable for us that about 70 to 80% of them know and understand this matter. However, we will continue motivating them through being a role model and providing follow-up
ในการ
support.
พัฒนาโครงการในการปรับเปลี่ยนพฤติกรรม
น้องเคยเห็นช้างหรือเปล่าช้างมันก็โตไม่เบาจมูกยาวๆในกว่า
This activity is organized every morning before start working, modifying the hand washing procedure to match a Thai song that everyone has been able to sing since they were young children. All the 7 steps are finished as soon as the song ends. It is an example of local adaptation and review to ensure correct practice, and we can also teach service recipients.
โมเมนต์ค่ะ2ก่อนสำหรับ1ก่อนสัมผัสผู้ป่วยค่ะ
2ก่อนทำพันธการค่ะหลังสัมผัสผู้ป่วยค่ะ4หลังสัมผัสเลือดและสันหลังค่ะหลังสัมผัสสิ่งแวดล้อม
The knowledge gained is applied at work. For example, at this pediatric ward, every step is practiced regularly and continually. If any irregular incident occurs or a case of multi-drug resistant infection is suspected, various specimens or samples will be collected and sent to the microbiology laboratory for examination, and the infection control nurse will be notified. One important factor in confirming the spread of multi-drug resistant organisms is using the confirmatory test at this laboratory, which has modern equipment for examination and confirmation within a short period of time. That will positively affect the multi-drug resistance surveillance system. The lab results are sent through the modern IT system to all relevant units, including the hospital's Infection Prevention and Control Services Unit, for surveillance planning purposes. According to the monitoring and evaluation of the Infection Prevention and Control Services Unit, as per the practice guidelines given to staff of all units for continuous operations, the IPC system has not been 100% functional. The trends in multi-drug resistant infections have satisfactorily declined.
ความต่อเนื่อง consistency and
Dr.
persistency
Kamthon said, "We need both consistency and persistency in the implementation of this kind of system. A plan has to be drawn up to encourage each generation of healthcare personnel to realize, have positive attitudes towards, and observe the hand hygiene practices habitually and continuously. The knowledge transfer and application or modification of procedures are to be undertaken in a timely manner so that all practices become an organizational culture.
ระดับของความสนใจผมว่าที่นี่สนใจเยอะ
And then the results of the program operations will be submitted to the administrators of all branches of the multidisciplinary team to revise their action plans in line with the IPC guidelines so as to make their actions more efficient. For instance, today, the IPC committee is holding a meeting to discuss the use of medicines in the hospital. The resolutions will lead to the revision of the plan on rational drug use in healthcare facilities, according to the National Strategic Plan for Antimicrobial Resistance Management. The expected goals are to reduce the rate of antimicrobial resistant infections by 50%, reduce the use of antimicrobials by 20%, and increase the proportion of people with knowledge and awareness of antimicrobial resistant organisms and rational antimicrobial use by 20% through the promotion of knowledge management as well as research and development activities. Regarding knowledge transfer, addressing the problem of multi-drug resistant organisms cannot be done in only one dimension. Rather, the knowledge transfer and awareness raising are also the key to success.
อาจารย์คะหนูอยากจะถามว่าก่อนที่เราจะทำแผลผู้ป่วยนี่คือเป็นโอกาสที่เราจะล้างมือได้
This kind of atmosphere occurs in a classroom of nursing students. Its aim or concept being, upstream is the good starting point.
การล้างมือตัวเองรับผิดชอบในเรื่องของนักศึกษาพยาบาลนะคะ
Assistant Professor Sirilak Apiwanit, nursing instructor, said, "Nurses are important health personnel, most numerous in the hospital, and closest to the patients, and spend most time with the patients. We focus on nurses' knowledge and awareness about their role in preventing themselves from getting infected, not infecting the patients, and monitoring as well as managing the multi-drug resistant infection control effort."
เป็นโรงพยาบาลที่สนับสนุนในเรื่องของการล้างมือมากที่สุดใน
At Rama Hospital, the above examples will become a page of records on the Thai medical history in dealing with multi-drug resistant organisms based on the simple but powerful principle.